Hello everybody, it's Dr. Tokir Ahmed and Dr. Qasim Usmani, and today we're going to talk a bit about skin brightening and to give you some background information on the different types of skin brightening and the type of patients that it's suitable for. So, Dr. Qasim, what sort of inquiries are we having for skin brightening?
Two main types really. So we're having inquiries for targeted lightening for specific parts of the body, and we're also having inquiries about full body lightening as well.
Okay, so two very specific types of whitening: a generalized full body whitening and targeted whitening. The two are very, very different procedures. One targets, just like Qasim has said, for specific areas, whether it's the face, it's the neck, it's the hands, the knuckles, elbows, knees, and the toes on your feet. And the other one is dealing with a generalized full body whitening. Now, if we take targeted whitening first, targeted whitening is very similar to hyperpigmentation treatment, where we are treating areas of excess pigment which have darkened, and it can be for a variety of causes that have caused this to happen. And for that, we have a very specific regime depending on which part of the body it is, where we're using a combination of different types of Q-switch lasers, ND-YAG lasers, mesopeels, alkaline washes, mesotherapy, and the Silpharm X machine as well. It usually involves about 4 to 6 sessions, sometimes up to 8 sessions depending on the type of patient, and we're hoping to get up to a 70% improvement in the treated areas. So it's a very specific type of lightening that we tend to do. However, there is also inquiries regarding generalized skin brightening. And with generalized skin brightening, that involves treating the whole body. And that's done entirely differently, Qasim, isn't it? What procedure do we have for that?
We have that in the way of IV drips.
So, and in the IV drips, we are actually putting up an IV drip, which is then going directly into the bloodstream and circulating throughout the whole body. The most common ingredients that people are aware of are glutathione, vitamin C, but we do have a couple of other key ingredients which will boost up the process. Glutathione is a master antioxidant. It works in amazing ways. It detoxifies the liver. It purifies the blood. So as the blood circulates through your body, you've got a healthier blood, which gives you a radiance and a glow coming in from that. I mean, as well as sort of a detoxifying liver, it's anti-aging, improves mental functioning, improves your immunity. It's anti-aging. It does a whole series of lots of different treatments. And in addition to that, we use vitamin C. And with vitamin C is an antioxidant itself, but works primarily on the skin itself. It works on reducing the oxidative stress, which has caused the dullness of the skin, the darkness. It helps with anti-aging of the skin as well. And it also helps in reducing excess melanin activity. And melanin is the pigment which gives us the coloration of the skin. And sometimes we have excess melanin production. And we use a combination of that. Now, in order to do this, we have to be careful that we are selecting the right patients. There are certain genetic morphologies which make some people more susceptible to treatment than other ones. And in addition to that, there are a series of blood tests that we would want to do. And we do a series of screening blood tests first. We would want to check your kidney function, your liver function. We'd like to check your blood count just to make sure you're not anemic. And the reason for that is, it's not just about skin brightening, it's about wellness strips. Now, the condition of your blood reflects the colour of your skin. For example, if you're jaundiced, you turn yellow. If you're anemic, you're pale. If you're cyanose, you're blue. So what we want to do is the skin to be radiant and glowing. So if there's any background problems, they also need to be looked at. One of the most common ones in people that come to us is usually iron deficiency. So we're checking the iron, the vitamin B12 and the folic acid levels in case that needs to be augmented as well. Once we have that, we're able to take a very personalised approach to what we think is going to work for you. But on average, people do require about 12 sessions a week apart. And once that's done, we recommend maybe a maintenance session once a month for 3 months, and then a session once every 3 months, just to keep the clock ticking over just nicely, just to maintain it through. Very high success rate, lots of happy patients coming in to have it done. Very, very popular treatment. But it is important that what you are having is a bespoke cocktail which is made to your requirements and to your blood requirements, not just something that comes off the shelf. It's with view to this that we're having a lot of patients coming in because we've got another secret ingredient that we're able to add in, which is alpha-lipoic acid. Now, alpha-lipoic acid as an antioxidant is 400 times more powerful than vitamin C. There's a very strict criterion who we can administer it to and how it's administered, but it enhances the results immensely. So when you're coming in, when we're gauging you, when we're doing the assessments, we're looking at what we can offer you, what the realistic achievements are, how many sessions, and normally it takes about the 7th or the 8th session before you actually start to see some results. We have had a couple of patients after the 4th one have just absolutely amazing. Reviews are there for everybody to check out. So when you do generalized full body lightening, you have to remember that if you have areas that are darker than other areas, they will remain darker, although the tone of the background skin at the darker area drops down by about 2 tones, the difference is still there. And for those patients, we're recommending targeted whitening in addition to the full body whitening that we're having done. Great treatment in the right hands, delivers excellent results, and we've had an amazing treatment profile because we're able to look and analyse what you're actually looking for. And I think a lot of the patients that are coming in are actually looking for targeted lightening, and we do get a lot of patients that have hyperpigmentation as well and dark circles, and all these things need to be managed individually to give you the desired outcome. Thank you very much for following us today. A quick brief synopsis on skin brightening for you. We look forward to seeing you again.